In April of 2015, Clark County started a pilot program to see if employee workers' compensation injuries could be reduced. The county hired Action Onsite, a preventive and proactive ergonomic consulting company. Based on the physical work and number of past injuries, Public Works was chosen for this program.
Working in workers' compensation, typically we've always dealt with employees after the fact, so we've had a very reactive program. And one of the things I've been looking at is how do we become proactive? How do we catch employees before they become injured or early enough to where they're not having to take time off to the doctor, we're not having recordable injuries, time loss.
There are 2 Action On-Site employees working with Public Works for 5 hours a day, 3 times a week. The county has provided them with a small office at the downtown campus and at the 78th Street Operations Center. Action On-Site is often out in the field visiting Public Works staff to observe how they go about doing their jobs while at the same time building relationships.
We focus on the small things that could eventually lead to big things. So it's obviously catching symptoms before they become a major problem for people. So a lot of it has to do with kind of looking at the ergonomics of how people are working. It could be office staff to field workers.
Action On-Site asks questions, listens, and provides feedback on how best to perform tasks ergonomically. They also recommend specific stretches as well as proactive wellness suggestions to improve posture, strength, and health. Action On-Site caught up with the Washougal crew as they cleared some beaver dams to prevent the backed up waterway from flooding a county road.
One of the things I would spot with this is some hip flexor possibilities. A possibility that they might strain the hip flexors just by lifting up in mud. Another thing was when you're stuck in the mud, you can't pivot. We always want people to pivot rather than twist. When you twist, that's potential for some knee injury.
We've had really great employee participation, a lot of really positive feedback, able to catch a lot of injuries before they become injuries. They have really good stretch programs out there that employees will participate in.
Yeah, a lot.
I've used Action On-Site. In this kind of line of work, we spend a lot of time on our feet. And he taught me some stretches because I was starting to get some plantar fasciitis, and he taught me to stretch my calves out properly, and that helped relieve the pain in my feet.
You know, if they're happy and healthy here, they can go home and be happy and healthy. And that's really kind of the goal, is how do we make that impact? In the time that we've had it in place between April of last year till the end of the year, so every calendar year we have to report in, they had 6 fewer recordable injuries.
The county's early prevention pilot program has so far paid for itself. It's part of a proactive trend on where workers' compensation is headed.
Our goal is to, within 1 to 2 years of being rolled out countywide, to reduce our workers' comp costs by about half. So reduce the amount of money we're spending out in workers' compensation claims, which then essentially actually pays for the program.